Trigger points in the masseter muscle belly are located at both the superior and inferior attachments at the zygomatic arch and angle of the mandible. The location of the referrals are primarily in the temporal bone with slight spillover into the lateral occipital ridge, posterior and inferior portion of the jaw along the mandibular line and angle of the mandible, with interesting spotted referrals both above the eye and along the maxillary body as well. These pain referrals will primarily be described as headache type referrals. Trigger points for the temporalis muscle are located throughout the belly of the muscle, both in the posterior and anterior fibers, as well as the middle fibers of the muscle itself. The location of the pain referrals are spotted headache type referrals in the temporal and frontal bone, as well as a looping type referral in the posterior eye that can sometimes be felt in the region of the upper jaw. Last, we have the medial and lateral pterygoids with pain referrals both in the area of the inferior orbital region. This is mostly going to be described as a sinus type headache or sinus type referral, as well as into the external auditory meatus mastoid process and down the lateral portion of the upper cervical spine along the transverse processes in the neck.